is a See Jason podcast. I am Dr. Jessica Kendrick, a nephrologist, professor of medicine, and program director of the Nephrology Fellowship at the University of Colorado. I am joined here today by Dr. Gina Dixon, a fourth-year Med-Peds nephrology fellow at the University of Colorado. On behalf of all the authors, we are excited to share the results of our recent manuscript published in See Jason. In this work, we examine the awareness of current policies and United States Nephrology Fellowship programs regarding parental leave, pregnancy breastfeeding accommodations, and fellows' perspectives on family planning.
This project was completed as a part of the Dr. Lili Zhao Women in Nephrology Leadership Fellowship. At the time I was completing this fellowship, I was a second-year nephrology fellow and pregnant with my now one-year-old. Dr. Kendrick is both my WIN mentor and my own program director, so we felt this project was pertinent and timely. We performed an anonymous online survey of U.S. nephrology fellows. Participants were recorded via email sent to their training program directors. The survey consisted of questions regarding parental leave, pregnancy and breastfeeding accommodations, access to childcare facilities, and perspectives on family planning. 121 nephrology fellows submitted the survey, and 98 completed the survey in its entirety. 62% of respondents were female, and 37% currently had children. We found that the majority of fellow respondents were unaware of national policies, and these included policies from the American Board of Internal Medicine and the Accreditation Council of Graduate Medical Education, or ACGME. They also were unaware of their own program policies surrounding pregnancy and parenthood. 42% of respondents were unaware of the duration of parental leave at their program. Nearly 45% of fellow respondents were unsure if their program limited night shifts or shifts greater than 24 hours for pregnant trainees. 43% reported they were unsure of lactation accommodations, and 40% were unsure of access to subsidized childcare. When fellows received work accommodations for pregnancy or parenthood, their work obligations were largely covered by co-fellows at 60% or attendings at 38%. Over 60% of fellows agreed or strongly agreed that they would avoid a pregnancy in fellowship due to concern that they would have to extend their training. Of the fellows who chose to pursue pregnancy or parenthood during training, 75% did not change their career plans as a result.
To our knowledge, this is the first in-depth study examining pregnancy and parental leave policies in U.S. Nephrology Fellowship training programs. While we highlight the experience of U.S. nephrology fellows, we recognize that these issues are inherent to all U.S. and potentially all global medical trainees. Other studies have noted that training programs may not be fully aware of or may misinterpret parental leave policies established by certifying boards. And our data further highlights a lack of awareness, but at the individual fellow level, not program level. Individual nephrology programs have the ability to improve fellows' awareness of program policies. Programs should ensure that their program handbook, their website, their orientation includes information on their individual as well as national parental leave policies and pregnancy and lactation accommodations. Programs can advocate for institutional improvement of lactation accommodations, including access to lactation rooms that are conveniently located, available when needed, and have the proper equipment. Training programs also have the opportunity to increase trainee awareness and advocate for primary enrollment and subsidized childcare for their trainees. Involving their local graduate medical education or GME office and other program directors may contribute to trainee policy changes.
It has been shown that pregnant women who work rotating shifts, fixed night shifts, or greater than 40 hours per week have an increased risk of adverse pregnancy outcomes. Some training programs have adopted policies that preclude pregnant trainees from working overnight shifts or call shifts during pregnancies. Smaller nephrology programs might have difficulty finding coverage for their pregnant trainees when these policies are enacted. In our program, we found allowing co-fellows the opportunity to moonlight and volunteer to cover shifts results in improved fellow satisfaction and less fellow burden.
Our study has several limitations. First, we were unable to determine a response rate as we were unable to directly survey nephrology fellows. Second, there may be a respondent bias in those who have responded versus those who did not respond. We are unable to determine any causal relationships in this observational study. In addition, we do not have any information beyond the survey. Awareness surrounding parental leave, pregnancy, and lactation policies may be similar to awareness of other institutional policies.
It's important to highlight that nephrology fellows who choose to pursue pregnancy or parenthood during fellowship are quite professionally successful. The majority of nephrology fellows reported that pregnancy or parenthood did not change their career plans or affect their pursuit of an additional degree and did not affect their research productivity. Our study highlights lack of awareness of parental leave policies, pregnancy, lactation, and childcare accommodations among U.S. nephrology fellows. While the topic itself has broad impact as it pertains to all physician trainees, individual nephrology programs are able to implement changes to improve awareness about both national and local program policies among trainees.
This is Dr. Connie Ree, Editor-in-Chief of CJSON. On behalf of our editorial team, I would like to thank Dr. Kendrick, Dr. Dixon, and their co-authors for leading this article and podcast and for their important contributions to the journal. Thank you all for listening in, and we look forward to connecting with you next month on the CJSON podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.